Tech-enabled healthcare is a backbone of a thriving, future-ready society. Today, we are speaking with Weijie Poh of Digital Lifeline.
Every country has to face with right now, it's really the aging populations, plus the fact that we are dealing with the lack of allied healthcare workers. So how do we as a ecosystem be able to have the sufficient resources and capabilities to address the surge in patients as we start to move the capabilities of healthcare services from tertiary hospitals to primary care? Then that's when we need to start thinking about how do we allow these devices, these innovations to be easier for the layperson to use it, right? Instead of just miniaturizing the devices into a portable format. And because that's really where in the community, that's where we don't have the specialist level training, we don't have the skilled healthcare workers that are there to operate it. So it really has to be simple for the layperson, the GP who's not trained in that particular discipline to do this, operate this. Then at the same time, ensuring that whatever data points we get from these devices, we can have a quick decision that allows us to make a quick decision as to is this a case where we need to refer on, or do we need to say, come back, you're okay, come back in a couple of months. And that decision making to us has to be made on the spot. Any additional step in the patient journey that's drop off. And you don't want that to happen because especially for what we are doing in the elderly care sector, the moment they leave the primary healthcare site, it becomes really difficult for us to engage them onwards. So we want that particular screening, the analysis, the decision making to be happening on the spot. I think in Asia, it's really going to be more about how do we manage chronic diseases in the community. For us, something that's very close to us is your vision, your eyesight, right? And I think a lot of times, how do we do that? How do we bring that expertise in hospitals, eye clinics into the community so that it becomes a lot more accessible to people, so that we can catch disease earlier and have better outcomes. I think that's where we do see the favorable trend happening towards. I think I have had 15 years of startup experience. I know the pains in terms of the execution, and particularly I think a lot of times we tend to, like you said, romanticize the entire journey. But in terms of execution, it could be things that we very often neglect to think about, like adoption. How do you drive adoption? Is getting regulatory approval the only metric of success? In terms of, there's a lot more stakeholders that we need to engage. Stakeholders that may not be that inclined to change their workflow, and how do you do that? And I think that's what I hope to bring to the table with my background.